Hello, I'm Sarah Day, Policy and Research Manager at HFMA, and you're listening to HFMA Talk, the podcast for NHS Finance. As part of our support for members throughout the coronavirus pandemic, we are recording a series of podcasts that hear from people working across different sectors, regions and roles to understand the impact that Covid-19 is having on their organisation and their teams. Sharing learning at this time of rapid change is essential and can support all of us as we work in new ways. Our guest today is Suzanne Robinson. Suzanne is Executive Director of Finance at Pennine NHS Foundation Trust, which provides mental health and learning disability services in the Greater Manchester area. We have discussed the importance of maintaining good mental health and well-being in previous podcasts, but we hear very little about how Covid-19 is impacting organisations in that sector. In this episode, Suzanne explains how coronavirus is changing working practices for her trust. Hi Suzanne, thanks for joining us today.
Hi Sarah, you okay?
Yeah, all good, thank you very much. Could you start by telling us a bit about your trust and the population you cover and how COVID-19 is beginning to impact your area?
Yes, so I work at Pennine NHS Foundation Trust, and we are a mental health and learning disabilities provider based in Ashton-under-Lyne in Greater Manchester. So we cover 5 of the 10 boroughs of Greater Manchester. Greater Manchester itself serves a population of about 2.8 million, and we cover about 1.3 million of that. So we provide inpatient and community services. We also provide some specialist services, in particular for children and young people, for trauma-informed care and for military veterans. So we work across approximately 100 sites, and we have about 460 beds. Just in terms of our staff, we employ just over 3,600 staff, and we support around 100,000 patients every year. So in terms of COVID-19, we have started to see quite a significant impact on our services. We currently have 26 patients that currently test positively for COVID-19. The majority of those are within our wards. So 7 of our wards at the moment have patients testing positively, which means that our nursing staff are required to barrier nurse a number of those patients, and that's to keep them safe, not only for our staff but also for other service users who are on our wards. A number of our service users stay with us for quite a period of time, so that is quite impactful for them and for our staff, especially when we have more than one patient who's positive testing. Across Greater Manchester, we are starting to see an increase in the number of people that have unfortunately died, and we were informed that one of our service users very sadly lost their life to coronavirus last week, and that has impacted on our staff really significantly, especially because those staff have nursed this gentleman for a number of weeks, and I think they've shown some real bravery, compassion and real resolve throughout this whole situation.
I wonder, could you just explain a bit more about what you mean by barrier nursing?
So barrier nursing means that people are nursed in a separate place to other patients. So we don't have wards which have beds in quite the same way as an acute trust would have. Most of our patients have their own bedroom and ensuite facilities. When we barrier nurse, we keep them separate and we segregate people, which is difficult because it means people can't use the facilities on the ward in perhaps the way that they're used to. But it means we have to have a higher ratio of nurses supporting those individuals.
Okay, thank you. So how's COVID-19 impacting how you deliver all of your other services? Obviously, there is an impact on your inpatient wards, but I'm assuming it is making you change how you deliver your normal services as well.
It is, yes. So at the moment, we've got about 12% of our staff who are unable to work. So we've been working really, really closely with colleagues at Greater Manchester Mental Health, which is our neighbouring mental health provider, and Greater Manchester Health and Social Care Partnership, which is effectively our STP. And we've been doing some work to risk stratify and prioritise our services across each of those boroughs. It's really important that we understand the risk and our ability to provide each of our services and make sure that we can protect our most critical services during this period, and that changes on a day-to-day basis as the pandemic develops. We've started to introduce some new ways of working to help us manage these changes. So we've introduced remote patient consultation for a number of our clinical interventions. We've started doing things such as training online. So one of the real great successes from last week is we managed to train 103 of our doctors in palliative care training via Zoom, which would have been unheard of, I imagine, before this happened. But one of the biggest challenges for us is how do we support our frontline services to make sure that they can continue to provide the same level of services for as long as possible. So we've started to deploy some of our corporate staff out into services to help in that respect. So one example will be, as I'm sure many people have heard, some of the challenges we have around the deployment of PPE. So we have corporate staff that are now based in each of our localities to make sure that our wards have their stocks replenished on a regular basis from our central stores. And just that one change has actually made such a difference to making sure that people have the equipment that they need. And we do need that equipment, even though we're a mental health and learning disability provider. Our staff who are interacting with people who have tested positively and potentially displaying symptoms also need to make sure that they're protected. So the equipment is just as needed as it is in the acute sector.
Yeah. Are you seeing any changes in demand for your services?
At the very start of the pandemic, we did actually see a reduction in the requirement for some of our inpatient beds, but that's not necessarily maintained now. What we have seen is an increase in some of the demand within our community-based services, but I think some of the technology that we've introduced is really starting to help us in that respect. So one of our clinics in Bury actually reported that they'd seen a reduction in their DNA rates as a result of introduction of video consultation and technology. So actually, I think by embracing some of the new technology that's out there, it's going to help us manage some of the demand that will come in the future too.
And are you delivering any specific services for COVID-19?
We don't deliver any specific COVID-19 services, but it is having quite a significant impact on our patients and our staff. Either the staff who have the virus themselves, a number of our staff are self-isolating at the moment, whether that's through their family members with suspected symptoms or themselves. So we are seeing quite a big impact and a requirement for us to do things differently as a consequence, particularly about how we provide services. So in our trust, for example, last week we didn't have a helpline for our patients or carers, and throughout the last 7 days, with our corporate, our operational and our clinical staff working tirelessly, we've been able to set up a 24-hour helpline for our patients and carers. This actually went live only on Saturday, a couple of days ago. And I think as the weeks unfold, we'll see and we'll be doing lots of things differently. Lots of things that we didn't think were possible before. Things that we never knew we could do. I think there'll be examples like this up and down the country where organisations have really gone above and beyond, and despite some of the pressures that we're all feeling, we can still put in place new services in response to COVID-19. It really is quite remarkable. We've also been doing some work with our Manchester Resilience Hub. And this was established in response to the Manchester Arena attack, and it was intended to coordinate the care and support for children, young people and adults whose mental health or emotional well-being has been affected as part of that incident. And we're looking at how that model might help provide some additional support and consultation in the wake of the Covid-19 pandemic, and to provide support to teams or organisations and support frontline key workers. So that's a new development that we're really hopeful can provide some much needed support in the coming weeks and months.
So have you had to change how you do things as an organisation? You're obviously putting things in place a lot quicker than you normally would. So I'm thinking about, have you had to change the way you manage your financial governance, your purchasing decisions, etc.?
Yes, we've had to review all of our governance arrangements. We did a big piece of work to review all the programmes of work and the projects that we were doing as an organisation and decide which of those would need to be stopped or paused or re-evaluated as part of this. So we've put some agreements in place via our board as well to change the way that works. So, for example, we've effectively collapsed our quality, our performance and finance and our people and workforce committees into one, with a much stronger focus on what's happening in relation to Covid-19. We've reviewed our financial governance and decision-making processes and developed some new ones. And those will help us fully identify any costs in relation to Covid-19. And those processes were all approved by our board last week, and they're all designed to make sure that we can make some very swift but appropriate decisions that are still reflect our standing financial instructions and still make sure that we can demonstrate value for money, and we can be really clear about how we've deployed additional costs throughout this process. Our finance team have been helping us with that in particular. So we've designed an online business case process, which enables us again to capture the key information but turn around decisions very, very quickly as part of that process. We've also set up specific inboxes to receive queries around PPE. And we're doing lots of purchasing across a much wider footprint. So we're doing lots of purchasing across Greater Manchester to make sure that we get the equipment that we need. So lots of collaboration with partners during this time.
Mm. And have working practices changed? Have you got more staff working at home during this period?
Yeah, so we currently have about 1,000 of our staff, so just over a third of our staff are currently working from home. My finance team, 100% of the team now work from home. So we've been using Microsoft Teams to keep connected. And broadly, it is going really quite well. Apart from today, actually, we're experiencing some issues with staff not being able to access the VPN. But I think we've just got to accept that this will happen from time to time. Last week, at the height of our traffic, saw 917 staff concurrently remote accessing via their VPNs, and that's it's a really huge achievement. But we're going to make some additional investment to increase the bandwidth so that we can make sure that those staff that are working from home can do that as effectively as possible. Our business continuity plans kicked in 3 weeks ago. So we've been training staff within our department, so within finance, for example, to be able to cover our business critical functions, which are mainly things like procurement and accounts payable. And that enables us to provide some resilience should, unfortunately, any of our staff from our key areas, our business critical areas, become poorly or unwell during this period. And I think there's a general team effort. So even I've offered to do some working papers, because we must remember this is the time of year that we're doing our accounts. I must admit I've not actually had any offers yet, any takers on that one. But there is definitely a sense of people helping and supporting one another during this period. And we've also seen some really great examples of innovation coming throughout this period. So, for example, we've just introduced a new process of invoice approval using electronic sticky notes. And I know the team have been working on this for quite some time, actually, but they've been able to actually put that in place within a week, and they've done that remotely because they have to work remotely. And so it's really forcing some innovation and some changes. And I think what's really important actually is that we do capture these examples of where doing things differently can help us to work in these virtual world that we're in at the moment. So I'm really keen to promote these examples of best practice across the whole of the finance network, using things such as the value makers. We can't forget that we've got 1,600 value makers across the whole of the country, who are all there to help share best practice, share ideas, share innovations. And I really want to make sure that we exploit that network, because we'll all have examples of great practice that's happening that can support us all in this very different way of working.
Yeah. And as you say, it's a very different way of working, and it can feel quite odd for people to be working at home and effectively isolated from their teams despite the virtual world that we've got. How are you supporting your team to maintain their resilience and to keep going during this time?
So we've been doing quite a lot of work with our staff. So we have a daily coronavirus update, which is for all staff, and that keeps people up to date with the guidance that's being issued, how it will impact on them, how it can support them, how they can access services such as our wellbeing service, which we're looking to develop even more to provide more support for slightly different circumstances that we're in at the moment. We've also been developing our own materials to help people cope with working from home. So actually the HFMA top 10 tips for working from home was incredibly useful. I think this really does highlight the importance of having some daily structure to working day, to make sure people are taking proper breaks, people are keeping well hydrated, that people are keeping in close contact with their team and their colleagues, and eating properly. I know this is one for me that I'll have a tendency to graze all day, but actually keeping some structure and eating lunch at the right times, as you would if you were in the office, are all really important things to help our staff. Wider than that, say we've been developing our wellbeing service offer to reflect the sorts of anxieties that our staff are feeling during this time, and there's some more guidance will be issued nationally this coming week, so we're trying to make sure that we blend that with what's available nationally. We're also looking to introduce care packages, and this is an initiative that we agreed as an organisation only this morning actually, and that's about encouraging our frontline staff to take a break, and our care packages will involve just things like tea and coffee and water, some fruit, some hand creams in there. But the point of them is to encourage people to, despite being incredibly busy, to recognise how important it is to take a break and take some time and just have a bit of space during what is a very, very, very busy time. Yeah. We're also providing guidance for our staff to support them. How do you support the people who work for you, whilst they're off poorly, off sick, or whether they're just working from home? So how do we make sure that we keep in touch and keeping connected? I actually was talking to my finance department this morning, and that's 56 of us. We're in one big email just asking, how is everybody? How is everyone feeling at the moment? And I think that's really important that we continue to do that. Me personally, I use Twitter quite a lot, so I've been tweeting even more than I did ordinarily, and using that again to update people on what's happening in the organisation, to celebrate just how hard our staff are working at this time, and also for me to share some of the incredible stories of how hard my teams are working. So my IT department, my health informatics team, were working over the weekend to build hundreds of laptops to enable staff to be able to work from home. And that really does need celebrating, because people are genuinely going above and beyond. So it's a great place to do that. I actually have found it quite difficult to adjust to working from home. I think it really makes you realise how much you do rely on human contact, not only to get things done, but just just to have a conversation with and just to connect with people. It's an incredibly demanding time for us all, and I think we really do need to take care of ourselves. This is going to be a long haul. So as leaders and managers within organisations, I think we do need to recognise that. Without it, we won't be as effective as we could be. So we do need to allow ourselves to try and switch off. I think that's a really important message. So even though we're in a new, almost virtual world, and that's very different, the importance of connecting to one another and being supportive of one another. I mean, I'm very lucky, I think. I've got some really good networks. So I meet quite regularly, virtually, with my colleagues across Greater Manchester, my finance directors community, the regional finance team, provide contact with ourselves, and we have online webinars twice a week. I've got my own finance team and my informatics team and my estates team, which I stay well connected to. And then the executive team, we probably speak more than we did do before this had happened, and they're a really good support network for each other. And I think that's what we're there for. We have to be able to provide some stability, some confidence and some honesty to our staff throughout this, and just make sure that we let them know how grateful we are for the work that we're doing, and to support them in every way that we can.
Excellent, thank you. The mental health impact of the pandemic is going to go on for quite some time after the pandemic is over. How are you preparing as an organisation for that, and thinking about the future?
I think there's loads of work that's happening at the moment with that in mind. So I referred to the Manchester Resilience Hub earlier, and I think we're really hopeful that will be able to flourish. There is a real need for some support for people, whether that's our staff, in our organisation, but also in other organisations. We're hearing lots of messages from acute colleagues where staff are under unbelievable pressures on a day-to-day basis, and to have something in place for them to have some counselling, some support, some consultation. I really would hope that we could develop that offer in the coming weeks and months and provide that support network for people. We're also linked in regionally and nationally to the mental health networks, which are led by Claire Murdoch, and that's a real opportunity for us to discuss and share ideas and to coordinate what that response needs to be. Claire's a huge ambassador for this, as you would expect, and so there's discussions already taking place about what we might need to collectively put in place to support staff throughout this. So we're a part of that as well. And I think, as an organisation, what we're trying to do is make sure that we document some of the positives that are happening in the way that we deliver services at the moment. The last thing that we would want is actually, when we come through the other side of this, that we lose some of those positive ways of working, particularly around technology. So we want to make sure that we're almost documenting the business case, and describing the way that actually we can more effectively deliver services as a consequence of this, and that we don't lose that. Some of the fabulous examples that we've seen of that taking place.
Suzanne, thank you so much for your time today. That's been absolutely fascinating and really good to hear a perspective from a sector which isn't really being covered that much on the news at the moment when we hear about the pandemic. So thank you.
Thank you, it's a pleasure.
To support our members and colleagues, all Covid-19 related briefings, blogs and news articles are openly available on our website, hfma.org.uk. There is no need to be a member to access these, so please tell your colleagues. We are recording regular podcasts throughout the pandemic covering a range of areas. If there is a particular aspect that you would like to hear about, please let us know. The HFMA will also be providing more webinars on a range of topics to both support the immediate needs of the NHS finance community and future CPD requirements. We will do all that we can at the HFMA to provide support for the NHS finance community and maintain our networks. If you have any suggestions of other support that we can provide, please email us at policy@hfma.org.uk. Thank you for listening to HFMA Talk. Don't forget to subscribe to this podcast to keep up to date with new episodes.